How does it help? With midline orientation. So somebody have difficulty crossing midline. This is something they develop applied kinesiology or brain gym just for this type of problem. And some reflex, the main one is ATNR. The kid would have a problem crossing midline. Basically, the kid is exploring the left side and only the left side, the right side, and only the right side. So the right hand, the right ear, the right eye, and just on this right side. So you explore one and the other, but you cannot do diagonal movement, contralateral movement. That's going to create, if you are stuck with ATNR, number one, learning disabilities, learning delays, or the child go on one side and they on the other. So it looks like he's ambidextrous, but he's not. And again, go on YouTube, the Chikly channel, just put my last name, Chikly, C-H-I-K, not C-K, C-H-I-K-L-Y, Chikly ATNR or Chikly Reflex, and you see how we treat ATNR and what happened with what we have there. So the kid's going to work, and sometimes he has poor handwriting or poor motor skills, or you walk like a robot, left, right, problem with crawling. If I have to take an object here, rather than crossing, I'm going to turn my body all the way, funky rotation, and not grab. I cannot go crossing midline. So we have a very fun way to test it. It's pretty fast and efficient. We treat it, and it takes 30 seconds, 1 minute